7 bedtime habits that support heart health. Most people believe that heart health is decided in the gym, on the plate, or during a yearly checkup. But there is a quieter window of time, one that happens every single night that may matter just as much. What you do in the hour before you close your eyes could be shaping your heart in ways most people never think to question. This video is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. If you have concerns about your heart health, it is always a good idea to speak with a qualified healthcare provider who knows your personal history. Here is something worth sitting with before we go any further. Somewhere in the middle of this list is a habit that researchers have linked to changes in blood pressure and heart rhythm that many people never notice happening to them. We will get there, but first, let us start with the basics of how nighttime behavior and heart function are connected at all. Your heart does not clock out when the lights go off. While you sleep, your nervous system shifts into a different mode, one that is supposed to lower your heart rate, relax your blood vessels, and give your cardiovascular system a chance to recover from the day. Sleep scientists sometimes call this the parasympathetic shift, which is simply a fancy way of describing the body's built-in recovery mode. When that nightly shift is interrupted or blocked, night after night, the heart may not get the rest it depends on. Over months and years, that lack of recovery has been associated with higher risks of high blood pressure, irregular heartbeat, and in some studies, a greater likelihood of heart-related events. None of this means that one bad night will hurt you. It is the pattern repeated over time that researchers pay attention to. It helps to understand why this recovery window matters so much in the first place. During a typical night, the body moves through several distinct stages of sleep, cycling between lighter stages and deeper stages roughly every 90 minutes. During the deepest stages, something remarkable happens. Blood pressure, which usually rises and falls throughout the day in response to stress, movement, and activity, is supposed to drop by around 10 to 20% compared to daytime levels. Researchers refer to this expected drop as nocturnal dipping, and it is considered one of the clearest signs that the cardiovascular system is getting the rest it needs. When that dip fails to happen, whether because of poor sleep quality, an irregular schedule, or another disruption, the heart and blood vessels may spend the entire night working under the same pressure they experience during a stressful afternoon at work. Multiply that by 365 nights a year, for years at a time, and it becomes easier to understand why sleep researchers and cardiologists have started paying closer attention to what happens after the sun goes down, not just what happens during the daytime hours most people associate with heart health. With that foundation in place, let us walk through 7 habits tied to the hours before sleep that may be quietly supporting or working against your heart. Number 1. Keeping a consistent bedtime. The first habit is not about how many hours you sleep, but about when you go to sleep. Researchers who study circadian rhythms, which is the internal 24-hour clock that regulates hormones, temperature, and heart activity, have found that going to bed at wildly different times from night to night may be associated with a higher risk of cardiovascular problems, even in people who get a technically adequate number of hours. Think of your heart as an employee who thrives on a predictable schedule. When bedtime shifts by 2 hours one night and 4 hours the next, the internal systems that regulate blood pressure and heart rate are being asked to reset constantly, almost like resetting a thermostat every single day. Some research has suggested that this kind of irregularity may be linked to elevated blood pressure and greater strain on the cardiovascular system, independent of total sleep duration. Consider Frank, a 68-year-old retired mail carrier who prided himself on being able to fall asleep anywhere, anytime. Some nights he went to bed at 9 in the evening, other nights well past 1 in the morning, depending on what was on television. During a routine visit, his doctor noted that his blood pressure readings were inconsistent from visit to visit, and gently suggested that his irregular sleep schedule could be a contributing factor worth discussing further. Frank's story is a reminder that consistency itself may be protective, separate from the number of hours logged. A helpful approach that some healthcare providers suggest is choosing a bedtime window rather than an exact minute, and trying to stay within that window most nights of the week. This single shift, done consistently, may be one of the simplest and most accessible habits on this list. What makes this particular habit interesting to researchers is that it does not require any special equipment, medication, or dietary change. It simply asks the body to be given the same signal, night after night, so that the internal clock can anticipate what is coming rather than being caught off guard. Some studies looking at shift workers, whose schedules are often irregular by necessity, have found elevated rates of cardiovascular strain even when those workers otherwise ate well and exercised regularly, which has led some researchers to view a stable sleep schedule as its own independent factor, separate from diet and exercise entirely. For those whose lifestyles make a perfectly fixed bedtime difficult, even narrowing the range of variation from several hours down to about 30 or 60 minutes has been suggested as a meaningful improvement, rather than requiring an all-or-nothing approach. Number 2, avoiding heavy meals close to bedtime. The second habit involves something almost everyone has experienced at least once, that heavy, sluggish feeling after eating a large meal too close to lying down. Digestion requires blood flow, energy, and coordination between multiple organ systems. And when a large meal is consumed shortly before bed, the body may be forced to manage active digestion and the transition into sleep at the same time. Some research has connected late, heavy eating with increases in nighttime blood pressure, and a phenomenon sometimes called reflux-related heart discomfort, where acid reflux can mimic or potentially aggravate feelings of chest tightness. While reflux itself is not the same as a heart problem, the overlapping sensations can create confusion and additional stress on the body, particularly in older adults or those with existing cardiovascular conditions. Margaret, a 72-year-old grandmother from Ohio, described waking up almost nightly with a burning sensation in her chest after eating dinner around 9 in the evening. She had assumed it was simply heartburn, something to tolerate rather than mention. When she brought it up with her physician, she learned that the timing of her meals may have been amplifying both her reflux and, potentially, an unnecessary burden on her cardiovascular system during the night. Adjusting her dinner time earlier in the evening was one of several changes she and her doctor discussed together. Nutrition professionals often suggest allowing a gap of 2 to 3 hours between a substantial meal and lying down, giving the digestive system time to do its work before the body shifts into rest mode. There is also a metabolic piece to this puzzle that is worth understanding. When food is consumed, the body releases insulin and directs blood flow toward the stomach and intestines to support digestion. Lying flat shortly afterward can make it easier for stomach contents to move backward into the esophagus, which is the tube connecting the throat to the stomach, contributing to the reflux sensation many people associate with late meals. Beyond the discomfort itself, some research has suggested that eating late in the evening, especially meals high in sodium or refined carbohydrates, may be associated with less favorable overnight blood pressure patterns compared to identical meals eaten earlier in the day. This does not mean the exact same food becomes harmful simply because of the clock, but it does suggest that timing may be an underappreciated variable alongside the more commonly discussed factors of what and how much a person eats. Number 3, limiting alcohol in the evening hours. The third habit concerns a substance that many people associate with relaxation: alcohol. It is a common assumption that a drink in the evening helps the body wind down, and in some ways, it may create a temporary feeling of drowsiness. However, the relationship between alcohol and heart rhythm during sleep is more complicated than that initial sleepy feeling suggests. Alcohol has been associated in research with disruptions to heart rhythm during the night, sometimes described informally as holiday heart, a term used when irregular heartbeats appear after periods of heavier drinking. Even moderate evening alcohol consumption has been linked in some studies to increased heart rate variability disturbances and lighter, more fragmented sleep, both of which may reduce the restorative benefit the cardiovascular system depends on overnight. Robert, a 65-year-old former engineer, had a long-standing habit of having 2 glasses of wine after dinner most nights, a ritual he associated with unwinding from decades of a demanding career. After noticing occasional heart palpitations during checkups, his cardiologist asked about his evening habits, and together they explored whether reducing his evening alcohol intake might be a reasonable step. Robert's experience illustrates why it can be worth discussing personal habits openly with a healthcare provider, rather than assuming that a familiar routine is automatically harmless. This is not a suggestion to eliminate alcohol entirely for everyone, as recommendations vary by individual health history, but it may be worth being mindful of how much, and how close to bedtime alcohol is consumed. Part of what makes alcohol's relationship with nighttime heart health tricky is the gap between how it feels and what it may actually be doing internally. Many people fall asleep faster after a drink, which reinforces the belief that alcohol is helping their sleep. However, sleep researchers have observed that this faster onset is often followed by more fragmented sleep in the second half of the night, with more frequent awakenings and reduced time spent in the deep, restorative stages discussed earlier. Because those deep stages are closely tied to the nightly blood pressure dip the cardiovascular system relies on, disrupting them, even without the person waking up enough to remember it, may quietly undermine some of the recovery the heart depends on. For individuals who already manage an irregular heartbeat or a diagnosed heart rhythm condition, some cardiologists specifically ask about evening alcohol use as part of routine evaluations, precisely because of this documented connection. Number 4, reducing screen exposure before sleep. The fourth habit touches on something almost universal in modern life: scrolling on a phone or watching television right up until the moment the lights go off. Screens emit a type of light often called blue light, and exposure to this light in the evening has been studied for its potential to delay the release of melatonin, the hormone that helps regulate the sleep and wake cycle. Beyond the light itself, there is the emotional and mental stimulation that often comes with screen use, whether it is scrolling through stressful news, engaging with emotionally charged content, or simply staying mentally alert well past when the body would naturally begin winding down. Some research has connected chronic sleep disruption, including the kind caused by delayed melatonin release, with increased risk factors for high blood pressure and irregular heart rhythm over time. Take the story of Diane, a 59-year-old school administrator who described her nightly routine as scrolling through social media until her eyes physically could not stay open any longer, often past midnight. She noticed she often woke feeling unrested despite spending 8 hours in bed. When she began replacing her final hour of screen time with reading a physical book instead, she reported both better sleep quality and, interestingly, more stable blood pressure readings during her next set of medical visits. While her story is just one example and not scientific proof on its own, it reflects patterns that researchers have observed more broadly. Turning off screens at least 30 to 60 minutes before bed, or using night mode settings that reduce blue light, are steps some healthcare professionals suggest as part of a broader sleep hygiene approach. It is worth noting that the content on the screen may matter just as much as the screen itself. Watching a calm, familiar show is a very different experience for the nervous system than scrolling through an unpredictable stream of news, arguments, or emotionally charged videos, where each new piece of content can produce a small spike in alertness and potentially heart rate. Some researchers describe this as a kind of intermittent stress exposure, similar in principle, though far smaller in scale, to the cumulative stress discussed later in this video. Combining reduced blue light exposure with a deliberate choice of calming, low-stimulation content in the final hour before bed has been suggested by some sleep specialists as a more complete approach than focusing on screen brightness settings alone. Now, before we move further into this list, it is worth pausing to acknowledge that everything we have covered so far relates to what happens before you even close your eyes. What happens next in that transition into sleep itself may carry even more weight for your heart than anything we have discussed. That is where our next habit comes in. Number 5, managing stress and racing thoughts at night. The fifth habit is less about a physical action and more about a mental state, the tendency to lie in bed replaying the day's worries or anticipating tomorrow's demands. This pattern, sometimes referred to as pre-sleep rumination, has been studied for its connection to elevated cortisol, a stress hormone that can influence blood pressure and heart rate even while the body is at rest. When the mind stays activated at night, the body's stress response system, sometimes called the fight or flight system, may remain partially engaged even as a person tries to sleep. Over time, chronic nighttime stress activation has been associated in research with higher blood pressure readings and increased strain on the cardiovascular system, since the body is essentially being asked to prepare for a threat that never actually arrives. Consider the experience of Harold, a 70-year-old widower who described his nights as filled with worry about finances and his adult children, thoughts that would circle endlessly once the house went quiet. His physician noted that his blood pressure readings taken in the morning were consistently higher than expected for someone on his particular medication regimen, and gently raised the possibility that unmanaged nighttime stress could be playing a role. Harold began practicing a simple breathing exercise before bed, inhaling slowly for a count of 4, holding briefly, and exhaling for a count of 6, a pattern sometimes used to help activate the body's natural calming response. He described it as one of the more meaningful changes in his nightly routine. Techniques such as slow breathing, gentle stretching, or writing down tomorrow's tasks before bed are approaches that some clinicians suggest as ways to ease the mind out of an activated state before sleep begins. There is a reason breathing exercises in particular come up so often in this conversation. Slow, extended exhales have been shown in some studies to stimulate the vagus nerve, which is a major nerve pathway connecting the brain to the heart and playing a central role in activating the body's calming response. Unlike some other lifestyle changes on this list, this particular technique can be practiced in just a few minutes and does not require any special equipment, making it one of the more accessible tools available to someone whose mind tends to race at night. It is also worth acknowledging that occasional nighttime worry is a completely normal part of being human, and the goal here is not to eliminate every stray thought before bed, but rather to prevent a pattern of chronic, unmanaged nighttime stress from becoming the nightly norm. Number 6. Keeping the bedroom cool and dark. The sixth habit involves the physical environment surrounding sleep itself, specifically temperature and light. Research into sleep architecture, which refers to the structure and pattern of different sleep stages throughout the night, has suggested that a cooler room, generally in the range of 60 to 67 degrees Fahrenheit, may support deeper and more restorative sleep stages, including the slow wave sleep that is believed to be particularly important for cardiovascular recovery. Light exposure during the night, even small amounts from a hallway light or a glowing charger, has also been studied for its potential to interfere with melatonin production and disrupt the natural progression through sleep stages. Fragmented or shallow sleep, caused by an overly warm or overly bright bedroom, may reduce the amount of time the body spends in the deeper stages where blood pressure typically dips and the heart gets its most significant nightly rest. Eleanor, a 63-year-old retired librarian, had lived for years with a nightlight in her hallway and a bedroom that ran warm due to an older heating system. After a sleep study revealed that she was spending very little time in deep sleep, her doctor suggested some simple environmental adjustments, including blackout curtains and a small fan to regulate temperature. Several weeks later, Eleanor reported feeling more rested, and her physician noted improved consistency in her overnight blood pressure monitoring. Again, this is one individual's experience, not a guarantee of similar results for everyone, but it reflects a broader pattern researchers have documented. Simple changes, such as lowering the thermostat before bed, using blackout curtains, or covering small sources of light, are frequently recommended as part of a heart-conscious bedtime routine. Temperature plays a particularly interesting role here because the body's core temperature naturally drops slightly as part of the process of falling asleep, and a bedroom that is too warm can work directly against that natural cooling process. Some sleep researchers describe this as the body needing to feel like it is entering a cave, dark, cool, and quiet, in order to fully commit to the deeper stages of sleep. When the environment sends conflicting signals, such as bright light suggesting daytime or warmth suggesting activity, the body may remain partially alert throughout the night without the person ever being consciously aware of it. Over time, this kind of subtle, environment-driven sleep disruption may compound alongside other factors already discussed, such as irregular bedtimes or evening alcohol use, making the bedroom environment one of the more overlooked pieces of the larger picture. Number 7. Taking medications and monitoring vital signs as directed in the evening. The seventh and final habit is one that applies most directly to individuals who are already managing a heart condition or related risk factor, though the underlying principle is relevant to almost everyone. Many heart-related medications, including certain blood pressure medications, are timed specifically for evening use because blood pressure naturally follows a daily pattern, often dropping somewhat during sleep in a pattern researchers call nocturnal dipping. In some individuals, this natural nighttime dip does not occur as expected, a pattern sometimes referred to as non-dipping, which has been associated in research with a higher risk of cardiovascular complications over time. For people managing high blood pressure, taking prescribed medication at the time recommended by their healthcare provider, rather than at an inconsistent or forgotten hour, may play a meaningful role in supporting healthier nighttime blood pressure patterns. Consider the case of Patricia, a 66-year-old former nurse who, despite her medical background, often forgot her evening blood pressure medication amid the business of preparing for the next day. After noticing that her home blood pressure readings were higher in the mornings than she expected, she began setting a nightly reminder on her phone, timed to coincide with her bedtime routine. Over the following months, her readings became noticeably more stable, a change her physician attributed in part to more consistent medication timing. This habit is a reminder that some of the most protective nighttime routines are not glamorous or complicated. They involve simply following the guidance already provided by a trusted healthcare professional, consistently and without skipping steps, night after night. For those who use home blood pressure monitors, some healthcare providers also suggest taking an evening reading as part of the bedtime routine, in addition to a morning reading, since this can help identify patterns such as non-dipping that a single daytime reading in a clinic might miss entirely. Keeping a simple written or digital log of these readings, along with the time they were taken, can give a healthcare provider a much clearer picture of what is happening overnight than an isolated number ever could. This habit, more than any other on this list, highlights how heart health at night is rarely about a single dramatic action, and much more often about small, unglamorous consistency, applied quietly over a long period of time. Bringing these 7 habits together, a pattern begins to emerge. None of them on their own guarantees a healthier heart, and none of them replace the guidance of a qualified healthcare provider who understands an individual's full medical history. But taken together, they paint a picture of the night as an active, ongoing part of cardiovascular health, not simply a passive break from the day. One statistic worth remembering from everything we have discussed is the idea that irregular sleep timing alone, separate from total sleep duration, has been associated in research with meaningfully higher cardiovascular risk, a finding that surprises many people who assume that hours slept is the only number that matters. It may not be about perfection, but about small, sustainable adjustments made consistently over time. Looking back across everything we have covered, it becomes clear how interconnected these 7 habits really are. A consistent bedtime supports the body's ability to regulate hormones and blood pressure on a predictable schedule. Eating earlier in the evening gives the digestive system room to finish its work before the body shifts into rest. Being mindful of alcohol protects the deeper stages of sleep, where the heart does much of its nightly recovery. Stepping away from screens supports the natural release of melatonin and reduces unnecessary mental stimulation. Managing racing thoughts helps prevent the body's stress response from staying active long after the day's actual stressors have passed. A cool, dark bedroom gives the body the environmental cues it needs to fully commit to deep sleep. And for those managing an existing heart condition, following medication guidance consistently in the evening supports the natural blood pressure patterns the body is trying to achieve overnight. None of these habits exist in isolation, and small improvements in one area often seem to support the others as well. It is also worth remembering that no single night, good or bad, defines a person's cardiovascular future. The body is remarkably adaptable, and research in this area consistently points toward patterns built over weeks and months, not isolated events, as the more meaningful measure. This can be reassuring for anyone who looks at this list and feels they are falling short in several areas at once. Choosing even one habit to focus on first, whether that means moving dinner earlier, setting a screen curfew, or simply going to bed within the same general window most nights, may be a more sustainable starting point than trying to change everything at once. If you found yourself relating to any of these 7 habits, whether it was Frank's inconsistent bedtime, Margaret's late dinners, Robert's evening wine, Diane's late-night scrolling, Harold's racing thoughts, Alina's bright warm bedroom, or Patricia's forgotten medication, we would love to hear which one resonated most with you, and whether it is something you might consider discussing with your own healthcare provider. If this video helped you see your nighttime routine in a new light, consider sharing it with someone who might benefit from thinking about their heart health a little differently. And if you would like more educational content like this, subscribing helps you stay connected for what comes next.